Hi, good evening, and welcome back to this series on the professional exams made easy, where we discuss about some of the important topics from each section of anatomy, which are very frequently asked in university exam. We have covered up most of the gross anatomy topics, and we did discuss about the systemic embryology and general embryology topics in last two sessions. So let's focus on the histology sessions now. We will focus on the topics which are very frequently asked from general histology today, and we'll also discuss one of the most frequently asked question in the entire histology section, right? Uh, Usually general histology in majority of the universities asked in paper one, some of the universities paper two also, but usually the weightage of the histology is about 5 to 8, not more than this, right? So maybe there will be one short essay, one short answer, or one short answer, few MCQs. This is how it goes. So you have like limited topics in histology to cover. Wherever you have limited topics, please believe me, these are like high yield, high return topics for you, right? Uh, Lesser topics to cover, there is marks which is guaranteed, right? So let's actually know what are the frequently asked questions from general histology, and we'll also discuss about how to present an answer if histology questions are asked. We know how to write it for gross anatomy. We discussed how to write it for embryology. We will focus on histology today. So the first important topic in general histology actually begins with the types of epithelium. Now, you will not get short essays, you will not get short answers on this, but you will get plenty of MCQs, right? They will give a particular organ, a particular tissue. They will ask about the lining epithelium, covering epithelium, what epithelium lines the glands. Types of epithelium with location and examples is a very important MCQ. For both simple stratified as well as pseudo-stratified epithelium, you must know at least 2 or 3 locations, right? For example, simple squamous epithelium, what are the locations in which it is found? For example, mesothelium, the alveoli of the lung, the blood vessels as endothelium. This is how the questions will be framed. So you will get a lot of MCQs from uh, types of epithelium, especially. Okay. Then in the chapter of epithelium, if there is one question that is very frequently asked as a 5-marker question or even a 3-marker question, that is the transitional epithelium, or otherwise referred to as the urothelium, right? Among the epithelial tissue, this is one which is like very frequently asked as 5-marker. First thing, remember, any histology question is incomplete without a diagram, right? You have to write a diagram in histology and only using H and E pencils, except for, of course, the section of bone, then possibly the longitudinal section of peripheral nerve if it is specified, right? So H&E diagram for any type of tissue is absolute must, right? So transitional epithelium, how will you describe? Okay. So first, define what exactly is transitional epithelium, right? Why it is called as transitional epithelium. Then describe its structure. So how transitional epithelium is made up of? What is the basal layer? What are the middle layers? What are the top layers? What is the shape of the cells of the top layers? Why it is binucleate? All of this. Then also describe why is it called as transitional epithelium or also called as urothelium. Then probably a diagram. And believe me, if there is histology diagram, this takes 50% of the marks. So if you can show in a diagram, the transitional epithelium, nothing like it. 2.5 marks out of 5 is already there. The rest of it is for the description that you will write. Okay. Then possibly end it with location, where exactly it is found, and any histology question is again incomplete without the functional correlation, right? For example, why the transitional epithelium changes its number of cell layers. Remember, the number of cell layers does not increase or decrease. the superficial cells flatten out, giving a false appearance as though the thickness is getting reduced. What is the reason behind this? How the superficial layer prevent entry of toxic substances back into the blood, and it is excreted only in urine. So function or functional correlation is a must again, right? So this is how you should be answering if the transitional epithelium comes as a 5-marker question. Again, I'll stress 50% of the marks in your histology usually goes for diagram, right? Then classification of glands. Hi Tim. So classification of the glands with examples. So you should be able to classify glands based on the shape, their ducts, then whether the ducts branch or not. And then one more important way of classifying glands is based on the modes of secretion, right? Endocrine, exocrine, and in exocrine we have like merocrine glands, we have cytocrine, we have holocrine. So based on the mode of secretion, you should know the classification of glands. Okay, this could be an important 5-marker or 3-marker. Again, incomplete without diagram. Right. Then the next important short essay I would say in general histology is the connective tissue cells. Right? Classification of connective tissue, yes, it is important. Classification, I would say, so classification of connective tissue, I would say this is for MCQ, right? What is the example for dense regular connective tissue? What is the example for dense irregular connective tissue, right? What is the example for loose connective tissue? What is the example for embryonic connective tissue? These are the sort of MCQs that you will get on classification of connective tissue. But connective tissue cells is a proper 5-marker question where you need to divide the cells of the connective tissue into fixed cells, right? Fixed cells, and we have something called as wandering cells or migrating cells. For each of the cell, what you need to write? You need to write morphology. How does it look? What is the shape? What is the cell organelle? What is the nucleus? All of this. Okay. Apart from this, where exactly it is found, and then function. If you can know each of these connective tissue cells under these headings, nothing like it. Okay. Fibroblast. Where is fibroblast found in? Majority, right? What is its function? How does a fibroblast look? How does it look different from a fibrocyte? This is what the examiner will expect. Remember, histology, the examiner will expect you to write about morphology or features of the tissue or the organ. There is no point and there is no use in writing gross anatomy, embryology when histology is asked directly. So please focus on learning the structure, the microscopic structure, not even the gross anatomy, right? Then wandering cells again. What is the name of the cell? What is its morphology? Where is it located? And then what is its function, right? Then connective tissue fiber, we have seen plenty of questions on this also. Connective tissue fibers, as we know, are of 3 types: collagen, elastic, and reticular. Now, if you compare these fibers, how do you differentiate between these fibers? As I've told, whenever comparison is asked, the first column should describe features. Okay. Then the next column, let's say collagen fibers, elastic fibers, and reticular fibers. This is how your answer should be constructed. And maybe in the end, a diagram to show each type of fiber by its morphology. For example, collagen fibers run in bundles that do not branch. Elastic fibers are thin and they extensively branch. Reticular fibers are also extremely thin, and then these also form an extensive anastomotic network. What is the stain that is used for each of these demonstration of each of these fibers? Okay, all of these you need to list under features and then describe specifically for each type of fiber, right? This is regarding connective tissue fibers, collagen, elastic, reticular fibers. Then histology of cartilage. Invariably, if it is a 5 marker, it is on the hyaline cartilage or elastic cartilage. The question will be describe the microscopic structure of hyaline cartilage. Describe the microscopic structure of elastic cartilage. But if the examiner wants to ask about fibrocartilage, invariably it is a diagram only or features only, right? So fibrocartilage, I would say 3 marker, hyaline elastic, a definite 5 marker. In histology of cartilage, the other question that is very frequently is asked is location of the different types. And this is a very important MCQ. Similar to the types of epithelium, similar to the types of connective tissue. Whenever classification is involved, whenever types are involved, all those will become typical MCQs. We have discussed even in general anatomy, remember, types of joints, good MCQ topic, right? So wherever you have classification, wherever you have types, please think that those are the ones which are like stock questions for MCQs, right? Then the next important thing is the histology of compact bone. Now, as soon as you see this question, you will be absolutely happy that, okay, fine, there is a compact bone a question. Even in histology practical, you will be happy if you get bone slide because it's very easy to identify. This is one slide where none of the students are expected to go wrong. But the problem is when you want to describe the histology of bone, that is when the actual difficulty arises. For example, if you are asked to write the microscopic structure of compact bone, how would you do it? You will draw, let's say, a diagram of compact section of bone, right? Where you're showing that Haversian canal in the center, then you're showing concentric lamellae, and within these lamellae, you show lacuna and canaliculum, right? This is done, but how do you describe it? Remember, when you describe the structure of compact bone, you should always start with the coverings of the bone, right? So coverings, there are periosteum, which is the outermost covering, definitely. Endosteum is not a true covering because it lines the marrow cavity. You need to begin with this, okay? Compact bone is covered on the outside by periosteum. Then describe the 2 layers of the periosteum. Then deep to the periosteum, the entire bone tissue is organized in the form of lamellae, right? Now, what are lamellae? Lamellae are concentrically arranged bony matrix in which osteocytes or cells of the bones are embedded. So lamellae are of different types. So lamellae could be circumferential, right? Lamellae could be your Haversian system. Circumferential lamellae are outer circumferential lamellae, inner circumferential lamellae, which are found exactly at the periphery. If this is the marrow cavity, this is the inner circumferential lamellae, right? Then we have the osteon or the Haversian system. Most often, all students will end up writing only Haversian system, nothing else. Okay? It is absolutely essential for you to follow this structure when you describe the structure of the bone, microscopic structure, right? Haversian system, describe Haversian system in detail, right? Then talk about outer, inner is over. Talk about interstitial lamellae, which are found in between, right? This is how you should describe the structure. You need not get into the details of the bone cells. If you describe this much, it is done. A diagram and an answer to go with it. Use this as a template even to answer when you present your slide in histology practical. Okay. Please watch our practical videos where we have discussed the histology slides as you need to describe it in your practical exams to your examiner, right? So this is how you should structure your theory answer on the histology of compact bone. Here itself, if we want to ask one more question from the topic of bone, one more question that is very frequently asked is the bone cells, right? Now, bone cells could be a 3-marker question. If the examiner wants to make it like really easy, they will simply ask list the bone cells with its function. But if it is asked as a 5-marker, you need to mention the location, you need to mention the morphology, then its function, right? All of this need to be mentioned, right? So list the bone cells first, then take bone cell and start describing each. Or otherwise, again, follow a tabular column format to describe it, right? Remember, construction of a table is often considered as one of the signs of highest levels of knowledge, right? If you can construct a table while writing an answer, nothing like it. Okay, make it simple for the examiner. That's the thumb rule you need to follow, right? This is regarding bone. Then the most frequently asked question, if you go through any university, I would confidently say every alternate paper, you will see a question on histology of lymph node. Fine. If I have to bet my money on one question that can come in every exam from histology, I would put all my money on histology of lymph node, right? This is a hot favorite topic of your examiners. Fine. This is one topic that you need to be thoroughly prepared with, right? So histology of lymph node, and we will discuss how do we present the answer when histology of lymph node or any lymphatic organ is asked. Thymus, 5-marker, spleen, 5-marker, palatine tonsil, I would say the diagram, right? There is nothing much to describe in the histology of palatine tonsil for a short essay as per se. That's why this is most frequently asked as a 3-marker question. Otherwise, lymph node, thymus, spleen, all of these are definitive 5 markers. In spleen, I would further say splenic circulation. Open type of circulation, closed type of circulation, and what do we mean by compromise theory? Right. This is what is frequently asked also as a 5-marker question. Fine. So this is regarding the histology of the lymphatic tissue. Again, I'll repeat, if you have not read the histology of lymph node for your exam, that's a crime. Okay, you cannot do it. This is regarding some of the topics from general histology. We'll see the rest of the topics, but we will focus our session on how to present the answer for histology of lymph node a little bit later. Then, what are the other topics that we need to be prepared for? Remember, the comparison of 3 types of muscles. Again, this I would say is a very important 5-marker. Usually the question is compare and contrast the microscopic feature of skeletal muscle and cardiac muscle. Compare and contrast the features of skeletal, cardiac, and smooth muscle. Right? Again, you need to make that table. Wherever there are types, for example, 3 types of cartilage, 3 types of salivary glands, 2 types of ganglion, 3 types of blood vessels, 3 types of muscles, right? So, I'm sorry, these are the questions for which you should be ready with a table already, right? If this is asked in exam, this is how I'll describe, right? So, comparison of 3 types. Again, in the first hand column, mention all the features. Then the second, third, and fourth column talk about different types of muscles, describing the features. Don't forget to add a H&D diagram. Again, I'll repeat, any histology question is incomplete without a H&D diagram. You must write it, right? Then, within the topic of the muscles, one question which is very frequently asked as a 3-marker is intercalated disc. Again, when intercalated disc is asked, we will end up writing, let's say that intercalated disc is the characteristic feature of cardiac muscle. Beyond this, we will not be able to write anything if we have not studied intercalated disc. So intercalated disc is the peculiar feature of cardiac muscle. Totally agree. But what exactly it is, right? Intercalated disc is a specialized type of cell junctions which brings two cardiac myocytes together. Now, what are the three types of cell junctions present in intercalated disc? This is what the examiner will expect, right? So intercalated disc, what you need to do is define it, right? Mention the types. How many types? Three types of cell junctions which are present there. End it with function. 3 marks, 3 headings. Done. Right? So in cardiac muscles, this is one topic that you need to be absolutely prepared for. Right? I mean, in the entire topic of muscular tissue. Right? Then in the muscle itself, there can be a question on sarcomere, which is again a very important 5 marker. What is sarcomere? What is the structure of the sarcomere? How the sarcomere looks when it is relaxed, when it is contracted. You should be able to write both the diagrams. You should be able to write the actual representation of the thick and the thin filaments. What do we mean by the Z line, H line, M line? You should be able to expand these terminologies in your answer. Right? So sarcomere will be asked even in your practical exam. If you get skeletal muscle, if you get cardiac muscle, the examiner will definitely ask you to draw the diagram of sarcomere on the sheet, even if you have drawn the H&E diagram. Right? So you should be able to write the diagram of sarcomere. Done? Right. Then classification of neurons. There are a number of ways in which we classify neurons, but I want each one of you to remember the morphological classification of neuron, where we divide or group the neuron based on the number of processes they have. Apolar, unipolar, pseudo-unipolar, bipolar, multipolar. Example for each type. And this again is a very important topic for MCQ. In which of the following locations bipolar neurons are found? In which of the following locations pseudo-unipolar neurons are found? This is how questions will be framed. Am I clear? Right? So classification of neurons with examples, an absolute must. Right? Done. In the topic of nervous tissue, classification of neuroglial cells, this is again a definitive 5-marker. So you should be able to classify the neuroglial cells as neuroglial cells of the CNS, neuroglial cells of the PNS, right? So you should be able to write name of the cell, morphology, function, right? This is how you should be able to describe each of the neuroglial cell. Are we clear? Right? So this again could be very important MCQ. For example, satellite cells serve the function of, or what is the function of oligodendrocyte? Which neuroglial cells myelinate neurons in the CNS, in the PNS? Which neuroglial cells line the ventricles? Which neuroglial cells act as phagocytes? What is the embryological source of microglia? What is the embryological source of rest of the neuroglial cells? These are the sort of MCQs that you can expect. Are we clear? Right? So this is regarding classification of neuroglia. This is an important 5-marker and a very important histology MCQ. Right? Done. Then structure of a peripheral nerve. I would say a 3-marker. Okay? Where you need to draw the section of peripheral nerve. Let's imagine this is the section of the peripheral nerve covered by the epineurium. Then within the epineurium, we have the fascicles which are lined by what? Perineurium. Within this, we will have what? We will have endoneurium. And inside the endoneurium, what do we have? We have the neuron. The surrounding space is what we refer to as the myelin sheath or the myelin space, right? Remember, the same structure holds good for transverse section of, yes, skeletal muscle. Right? Are we clear? So this is regarding the peripheral nerve diagram that you need to be prepared for. This is, of course, the transverse section. Longitudinal section, if asked, this is again you need to write an HB pencil. We don't use HND stain usually to demonstrate longitudinal section, right? A transverse section, a definite HND diagram, but this, write it in your HB pencil. In HB pencil, remember you will write 3 diagrams in your exam. One is the longitudinal section of the peripheral nerve, the transverse section of the compact bone, the longitudinal section of the compact bone. For everything else, use your HND pencil. Right? Done. Then the next important question I would say is comparison of blood vessels. Comparison of large sized artery, medium sized artery, large sized vein. The 3 layers, how they differ. Again, in a tabular column format. Remember again, whenever the question is on comparison, I want you to prepare a table by yourself and reproduce the same table in your exam. Right? Make sure that the last part of the table contains a diagram of that particular histological structure. Are we clear? Right. Then comparison of structure of thin skin and thick skin. You should be able to write diagram. You should be able to differentiate the layers of the epidermis, the difference in the dermis regarding the presence or absence of different types of appendages. So you should be able to write a tabular column again under different headings, and then you should be able to draw the diagram of thin skin and thick skin. When it comes to thin skin and thick skin, I'll tell you, when it comes to your practical exam, as a student, even I was stressed. Okay. The examiner will definitely confuse you with the location of the thin skin and thick skin, right? So thin skin, where is it found? The thin skin is found in the entire body except the palm and soles, right? Then comes hairy skin and non-hairy skin, right? This is where they'll try to confuse you, right? And then when you start describing the structure, they will definitely ask about, is stratum corneum present in thick skin? All of us will say, yes, it is present. Immediate question is stratum corneum present in thin skin? Now you will start thinking, is stratum corneum present? Now, since it is thin skin, the stratum corneum is absent. Remember, no skin can be present without the stratum corneum. It is only the number of layers that differs. In case of thin skin, the number of layers is about 3 to 5, the keratin layer, whereas in thick skin, it can go up to 50. This is one place where the examiners will definitely play with you, right? So be careful, right? So this is regarding the general histology topics, okay? If I was preparing for my exam, possibly these are the topics that I would prepare and go. These are the topics that I would not miss. Anything over and above this is welcome, but you cannot miss these topics. Are we clear? Right. Now, I want to give a glimpse on, let's say, one of the most frequently asked questions, that is histology of lymph node is asked, right? How do we present it? Okay. Now, we have a diagram here, right? I want to give credit of this diagram to one of our students in our college. His name is Mithun Chakraborty. Mithun, if you are listening to it, I'm sorry I've taken it without your permission, right? His diagrams are very good. So I thought his diagram would be a perfect representation of how you should write a histology diagram. Okay. So this is the diagram of the histology of lymph node, right? Now, in histology of lymph node, or if the question is describe the microscopic structure of lymph node, right? How would you write? My suggestion, 50% of the allotted marks will always go for diagram, right? So 50% of the marks will be for diagram. The other 50% is for description. Unless the question is draw a neat label diagram of microscopic structure of lymph node. Unless this is specified, draw a neat label diagram only. It is understood that you have to write the diagram and you have to describe. And when you write description, remember, you are not writing the identification points, right? So please don't make your answer look like a spotter. If you make it look like a spotter, you will get the marks of a spotter, which is 0.5 or 1. You don't want it, right? So please focus on description. Now, how do you do it, right? So histology of lymph node. Now, how I would describe it. First, start with a brief introduction of what is lymph node. Lymph node is a bean-shaped organ located in between lymphatics, right? Bean-shaped secondary lymphatic organ. Done. That's it. Go directly to microscopic structure. In microscopic structure, how will you write it? Each lymphatic organ, let it be lymph node, let it be thymus, let it be spleen, all of these will follow a common architecture, which is it will have a fibrous framework, right? It will have a fibrous framework, then it will have a parenchyma. Now, imagine if you can write like this, I guarantee you that you will score out in your histology, right? So what about fibrous framework? The fibrous framework further has capsule, right? Then it has trabeculae, and then it has reticulum. Make sure that you are able to write at least one line of description about each of them. What is capsule? What is it made up of? What is its function? What is trabeculae? What is it made up of? What is its function? What is reticulum? What is it made up of? What is its function? This is it. You don't have to write everything that is given in your book, right? All that we expect is what is capsule? What type of connective tissue it's made up of? What is its function? And the same holds good for everything else, right? This holds good even for your thymus. Am I clear? Right? Then parenchyma, when you describe parenchyma, what we will do is we will describe it in terms of cortex, paracortex, and then medulla. So what is the structure of the cortex? What is the morphology of the cortex? In the cortex, we have lymphatic nodules, right? So let's expand this. This is a lymphatic nodule, right? A lymphatic nodule is made up of collection of lymphocytes, right? Now, what type of lymphocytes? In the cortex, we get B lymphocytes, highlighted. These lymphocytes are arranged in the form of lymphatic nodules. The lymphatic nodules are of two types. Now, what are the two types of lymphatic nodules? We have primary nodule and we have secondary nodule. What is the difference between a primary nodule and a secondary nodule? Any lymphatic nodule with a pale staining germinal center. Okay? A pale staining germinal center is what we refer to as secondary nodule. Secondary nodule is a reactive nodule. It is reacting against antigens. Primary nodule will never contain germinal center. Why the germinal center is formed? Once an antigen comes in contact with these lymphocytes, they start reacting and producing newer lymphocytes. The newer lymphocytes, which we call as lymphoblasts, are relatively large, right? And because of their large size, they will have more amount of cytoplasm. For example, let me show if I'm talking about a normal lymphocyte. This is how the lymphocyte will look. Its entire thing is filled by nucleus. If I'm talking about lymphoblast, the lymphoblasts are much larger, right? But the nucleus is still small only. So there is more amount of cytoplasm, which actually makes the germinal center look pale. This is a question you will be asked in your histology practical. What is a secondary nodule? What is a germinal center? Why the germinal center looks paler? Are we clear? Right. So this is what we need to write. Describe cortex, paracortex, and medulla. If you can describe the structure of lymph node under these headings, believe me, you will score out if you are good with your diagram. Right? If you are very good with your diagram, please write it first. Okay? If you are good with your content and you're not very good with your diagram, write the description first and possibly later write the content. Are we clear? Right? Now, this is how you should present the answer, even if it is asked for thymos. You need to follow the same thing. The only thing is the parenchyma there will not have the paracortex. When you write the spleen, the same, capsule, trabeculae, reticulum. But in spleen, what do we get? Red pulp and white pulp. Structuring the answer is important in gross anatomy. It is important in your embryology. It is as much as important even in your histology. And this is how you do it. Right? Now, I don't want to take up much of your time. I know that your exams are like nearing by. So this is what I wanted to present today in front of you. These are the questions you should be prepared with, and this is how you should present your answer. If you have any doubts related to whatever we have discussed since beginning, please go ahead. I'll be more than happy to clear it before we close. Okay. Please get on with your studies. I thank all those who were present there in the session. All the best again. If you have any doubt, please get in touch, and I shall be more than happy to clear your doubts. Okay. All the best. We will have one more session on next Monday, and we will focus on the questions from histology. Okay. We will come up with few important topics for discussion also. If you want me to discuss any specific topic in systemic histology, please let me know. I'll take up those topics. Right? Apart from this, I had few requests on specific questions. Fine. We'll try to cover those questions as well. If not during live sessions, probably a small audio or video recording I'll share. You can go through that. Okay. Thanks again. Study well. All the best.